Hi, everyone. My name is Alicia Barron, and I am the Education Manager for the Crohn's and Colitis Foundation down here in Texas and Louisiana. And I am very, very excited to offer you tonight's webinar. We're going to be talking about complementary and alternative medicine. And this webinar is directly related to feedback from all of you about what you want to hear about. So every single educational session that we do, we get evaluations, and every single one says that we want people living with, that people want to hear about complementary and alternative medicine. So I'm really delighted to be joined tonight by Dr. Matthew Hand. Dr. Matthew Hand has been one of my presenters when I used to work up in New England and is always got rave reviews. So I'm really excited that he was able to join us. Dr. Hand graduated from the Chicago College of Osteopathic Medicine in 1989. He did his pediatric residency and chief pediatric residency at Maine Medical Center in beautiful Portland, Maine. Subsequently, he did a fellowship in pediatric nephrology at Children's Hospital Boston. He went back to Maine Medical Center where he became the director of pediatric nephrology and helped to build what is now the Barbara Bush Children's Hospital at Maine Medical Center. In 2006, he entered Andrew Wheels, I think I said that right, Integrative Medicine Fellowship at the University of Arizona, and he became the Director of Pediatric Integrative Medicine at the Barbara Bush Children's Hospital. In 2011, he was hired by the Elliott Systems, where he still currently is, and he became the Director of the Divisions of Pediatric Nephrology and Pediatric Integrative Medicine, which is his this is where he is right now. He is also a pediatric nephrologist and a clinical assistant professor of pediatrics for Children's Hospital at Dartmouth. He has done lots and lots of presentations, including for us in Boston, Connecticut, Maine, Western Massachusetts, and now Texas and Louisiana. We're going to add us to the list there. And he's been on the Learning Channel. He's been on the Oprah Winfrey Show. He's been on 2020, and he's been on Discovery Health. So we are delighted to have you join us, Dr. Hand. So I'm gonna do a quick shout out here, though. We have a couple of sponsors for tonight's webinar. We want to thank AbbVie and Alpha Sigma for sponsoring tonight's webinar. So thank you all. And if you have any questions, we're going to be taking questions at the end of your presentation, Dr. Hand. There is a box over to your right, everyone attending, that is for questions. It says questions on there. You can write your questions in there, and then once we get to the end of the presentation, I'm going to read them to Dr. Hand, and we'll answer them that way. So be prepared for that. Be writing down your questions as we go. So I'm going to turn off my webcam now. I'm going to turn it over to Dr. Hand, and I'm going to make you the presenter and turn off my webcam.
All right, let me make sure I got everything here. All right, so do I need to show my screen? Is that what I need to do? Or do you have this? All right. Do you have this, Alicia?
You were going to show the slides from your screen.
Okay, so pull them up off of my own thing here. Okay.
Yes.
All right, let me just grab it here. Sorry, everybody. Let me just pull this up. I think this is it here. Bear with me for 1 second. I'm doing this from New Hampshire, so all right, we're almost there. How's that? Good.
That looks good. Perfect.
Everybody see it okay? All right. Well, now I can't see my face on here, which is probably good for me and for hopefully if you guys are still looking for me, you can still see me. As Alicia said, I'm Matt Hand. I'm a pediatric nephrologist and a pediatric integrative medicine doc. I started doing integrative medicine years ago, back in the mid 2000s. I became very interested in this after I got sick. I got a bad arthritis condition and my joints were all inflamed. I ended up being on medications for that and was trying to find a way to improve my overall health. I went through a number of different things, including changing my diet, looking at exercise, changing my exercise program from into a more Tai Chi sort of healing type exercise program. And in conjunction with that, said, let me see what I can do for my patients because it was helping me a lot. So I'm a pediatric nephrologist, but during my practice in Maine, I worked with our PEDS GI team, and we had a very large inflammatory bowel disease program up there. We started working together to try and help kids and young adults, and now in my population, adult population too, looking at how to bring integrative approaches into their treatment options. And it's been huge. We've talked to many different programs. We've worked over and over and over to bring this to help people out with this. As you're going to see, I'm not an alternative doc. I know the title was listed as alternative medicine, but I'm actually an integrative doc. And integrative medicine means looking at every modality, and we're going to talk a little bit about that here today too. What I used to give this talk and say and go through just what I did. And then I realized that as I was doing this, that I had so many questions that kept coming up and coming up and coming up. So what I've done is I've broken the talk down a little bit into not only what I do and what I do based on the data and the information that's out there, but also what do I get asked about all the time. I get asked about things at almost every conference I go to about this. And so I've decided to sort of address that in the second half of the talk. One of the most important things, though, is understanding what is complementary and alternative medicine. This may sound like it's sort of an obvious thing, but very often people have their own views as to what it is. We don't use the term CAM, or complementary and alternative medicine, as much as we used to. We use the term integrative care now. Even the National Center for Complementary and Alternative Medicine has put the term integrative care into it, because the concept of complementary and alternative sometimes sort of selects out this concept that conventional medicine can't really be part of it. And actually, that's not true at all. When we talk about complementary and alternative medicine or integrative care, we're really looking at every possible modality that can help a patient. My bulldog Omar, he might come wandering in here in a minute. He is an integrative technique. He comes in, he sees patients in the office, he helps them get their blood draw. He doesn't change their Crohn's or their colitis, but he changes their life when he's there. So anything that you can bring in that helps you heal and do well is actually part of integrative care. Integrative medicine isn't about necessarily curing. As most of us know, we don't cure a lot of things out there. We actually don't cure most things that are out there. On the other hand, what we can do is we can heal patients. And very frequently, and Alicia and I were talking about this earlier, the treatment with integrative techniques is not specifically towards the disease, but towards the patient's lifestyle. If you've got Crohn's disease and you can't sleep at night because your anxiety is high, well, I can give you all the Remicade in the world, but that's not going to help you in your life as far as your anxiety and with other things that are ongoing. And as we've learned, multiple factors come into the disease. They come into how our disease is, how our life is. And we have to look at all these factors in the healing process. We can't just look at one sort of isolated silo that we have. And so when I talk about integrative care, as you can see in this first slide, the first thing I bring up is conventional medicine. I'm commonly given these talks in academic settings, and it's very important for people to understand that conventional medicine has changed inflammatory bowel disease as we know it. When I was a resident years ago, I don't want to tell you how many years ago it was now, but we used to have the floor full of young people with Crohn's or ulcerative colitis and complications of the disease. And now we hardly see it at all. People are kept out of the hospital. The use of the biologicals have changed things dramatically. Our ability to use other therapies instead of high-dose steroids has really changed what we do with this condition. And more and more and more, we're coming out with different things that can be used that can be helpful with Crohn's and colitis. Having said that, it's not the end of the story. I always say when someone walks into their doctor's office, and including me as a nephrologist for a long time, you'd open up your toolbox and you had one tool. You'd open the toolbox up and the tool was a medicine of some sort. There might be 3 or 4 different medicines, but it's still a single tool. It's just a different kind of a hammer, if you will. You might have surgery as part of an option, and maybe you have, for me as an osteopathic doc, some manipulation. But for the most part, for treating diseases, we've really looked at one tool in the toolbox, and that's been medications. When we look at an integrative approach, we're actually filling the toolbox up with multiple other tools. And we're also taking it out of the silo, meaning you're not just somebody who has inflammatory bowel disease, or you're not just somebody who's suffering from depression, or you're not just somebody who's having chronic abdominal pain, even when your disease is in remission. You're somebody who all of these pieces are connected. And how do we approach each of these pieces with an integrative approach? And I think that's really the essence of it. I had a medical student on service with me today, and she looked at me and said, you're how do you change the culture? How do you get people not to just talk about the disease? How do we fix this? And I said, well, one of the things you tell people is they're not their disease. My kidney patients, I say, you're not your kidneys, or I tell the parents that the child is not their kidneys, and you're not your Crohn's, and you're not your UC. You are you, and the other piece is part of you and not all of you. Unfortunately, medicine has sort of flipped that sort of not optics, but it's flipped the way we look at things. And so we look at the disease rather than looking at the patient. And if we can change that, we can really change what we're doing with all of this. So conventional medicine is critical. And this is not one, I'm not here to tell you, stop your Remicade, stop your 6-MP, whatever you're doing. We need conventional medicine to treat Crohn's and colitis. We can decrease side effects of these medications. We can do that with a number of the different integrative approaches that we have, but we still do need to use them. And nutrition and diet is really important. And I always say, I feel silly when I say to people, well, you know, nutrition is important in inflammatory bowel disease, because it sounds so obvious. My 6-year-old patients walk in and say, well, of course nutrition is important. The hard part with nutrition is, in Western medicine, we've been taught it as sort of a biochemistry kind of thing. You know, calories per gram of whatever we're eating, or how much of a sodium or potassium, and we calculate all that stuff out. The reality to it is, what people really want to know is, what do I need to eat to be healthy? What do I need to do? And what's in my broccoli or my kale, or what's in my spinach or my cantaloupe, or what I'm eating? And is there a way for me to eat that to help with my inflammatory bowel disease? For years and years, the argument was, well, it doesn't really make a difference. As a matter of fact, we told people to eat sort of low residue diets, which were basically starches, and thought, well, that was better because people didn't have pain. And in reality, we're probably increasing their inflammation. We know, based on sociologic and epidemiologic data, that food plays a role in your inflammation, and inflammatory bowel disease is an inflammatory condition. So if we eat foods that decrease inflammation, we by definition are working to improve what we're doing from
Here, I think we're having a little bit of technical difficulties. If I'm the only one that can see
inflammatory bowel disease standpoint, it's really, really important. So, hello? Oh, sorry. Sorry, somebody just cut into the thing. So I think it's very important for us to understand that nutrition plays this role. Exercise and physical activity is really important. I mean, again, I feel silly even saying it. I ask patients, do you think exercise is important in your health? And they say, of course it is. Well, of course it is. But we have to realize that exercise does not mean, you know, six-pack abs and guns and P90X and what have you. Exercise is about healing ourselves. Every other culture in the world that studies medicine looks at exercise from a healing standpoint. Yoga, for example, from Ayurvedic medicine, looks at exercise specifically geared towards the gut and how the gut works. We know that it plays a role in how our body is. We know that exercise can be used to lower our stress and thereby change our parasympathetic tone and improve our gut motility. There's so much we can do with exercise that doesn't have to be, you know, just getting bigger and stronger or looking leaner or cut. It's one of the things that I think is really important as we evaluate what we're doing. When I had my arthritis, I remember saying to myself, I can only do 10 minutes on the bike. I could barely even move. I could barely lift the bar off the weight bench. And I was sort of embarrassed. I'm like, why am I doing this? The American Heart Association says I'm wasting my time because I'm not doing so many minutes and I don't have my heart rate up to a certain amount. But it was all I could do. And every day I did it, I felt better. And every day I felt like I took more control over my condition. And that helped me get through where I was at. Remember, when patients have chronic diseases, and I'm speaking to the choir, the fact is that they feel like they have lost control. Control is one of the most important things that we can give back to patients. We have to have them feel like they're controlling what's going on instead of us controlling what you guys are going through. And the more control a patient has, the more they're able to work on their healing process. It's hugely important. And But if we tell somebody to do something they can't do, it doesn't work. And so we need to be able to give them control back. Other parts of integrative medicine include things like whole systems, traditional Chinese medicine, Ayurvedic medicine. I love the use of them. Some places you can go and just see a traditional Chinese medicine practitioner or an Ayurvedic practitioner. Most often in integrative care, we're incorporating their concepts into what we do. So you might incorporate acupuncture in to help with your belly pain or help with your nausea. We might use yoga as a treatment. We might use Tai Chi as part of the treatment. Occasionally, the herbs or supplements that we look at, we pull in from there. These are very sort of comprehensive, sort of holistic approaches to medicine that are great to try and tie into what we use. And the data on them are getting stronger and stronger and stronger. And sometimes it's not even for the Crohn's or the colitis. It might be for your sleep. It might be for your headaches that go along with what you have. You might be having back pain, which many patients who have Crohn's or colitis have, and you can incorporate these things into what you do. Botanical medicine and supplements, and you can see they're sort of, I should put them together. For some reason, I didn't do it this time, but botanical medicine supplements are why everybody thinks they're coming to see me. Whenever we have an integrative talk, people say, oh, I don't want to take my Remicade. Can I, take fish oil or something like that? Everybody is looking, a lot of people are looking for this. And we'll get into the numbers here in just a minute. The fact is, botanical and supplements are definitely a part of what we do, but they are only a part of what we do. These are not the only thing. So yes, we incorporate many of the different herbs and supplements, and the data on these things are starting to get stronger to look at how we deal with the Crohn's or the colitis and decreasing inflammation or decreasing long-term effects, like how do we decrease cancer effects? How do we help with someone's sleep patterns? How do we help with some joint pain they may be having? So we work with those, but they're not the only things that we use in integrative care. Energy medicine, such as Reiki, healing touch, Qigong, these are all basically working with your own bodies or someone is their energy. I always say it's like working with your electrical system in your body. This can be pretty controversial in Western medicine. A lot of Western docs are like, listen, I don't believe in any of this. I've never experienced it. I don't think it's real. And also in some religious beliefs, you can't use these. So there are certain fundamental religions that say, listen, this is not okay. And that's important. We always have to be willing to listen and to hear and to respect people's belief systems. The big thing about this is you don't know if somebody has a spirituality unless you ask them, and that's the next category. Spirituality has become more and more important in medicine. It's one of the things that we as physicians don't feel very comfortable with talking about. I remember the first time I asked somebody if they believed in God, I sort of went, oh man, did I overstep a boundary here? Did I go too far? And it turns out that the more I have discussed things with people, the more I have worked with them, the more I've found out about what their belief systems are, the more I've been able to incorporate it into what they have for their treatment plans. Some people don't have a belief system and they don't want to go down that road, which is totally fine. But we also have to realize that this is important. In certain conditions, for example, in cystic fibrosis, this is one of the most important things that patients rank in terms of their healthcare, is their spirituality. And so I think it's important for us to remember that this is part of who we are. And sometimes our spirituality is just our sense of self, which if you're dealing with inflammatory diseases can get flogged. I mean, can really feel worn down over time. Manual medicine, such as osteopathic medicine, chiropractic, massage, PT, reflexology. These are all components that we bring in to help treat people. So I'm an osteopathic doc. I do tons of treatments. I treat kids with belly pain and kids with Crohn's who have low back pain. Almost universally, I hear people tell me who are dealing with IBD that they have low back pain. It seems to be what we call a viscerosomatic response. They just come in with this aching low back. And so while we're using the other therapies, we do some manipulative treatments to help them feel better. It's not going to cure their Crohn's. It's not going to cure their ulcerative colitis. But at the end of the day, they feel much better. They can be more active and they get done and say, hey, I feel better. And that's really what it's all about. And then mind-body therapies like self-hypnosis, guided imagery, biofeedback. These are wonderful in children. If kids will do them, you can have incredible effects with these because they have such great imaginations. Sometimes it's harder to get kids to do it because they feel it's sort of silly. And sometimes adults are even better because they're sort of invested in this. They're like, listen, I really want to use this to help calm myself, to sort of to settle my belly pain. One of the single best tools we have for chronic belly pain. So, you come in, you're going through your treatments, everything's going great. You're on whatever you're using, but your belly pain won't go away. And you're like, I can't seem to turn the belly pain off. Self-hypnosis works amazingly for this, or biofeedback, or guided imagery. These are ways to down-regulate that sympathetic response and really help take that pain go away, or make that pain go away. So are people using it, and how much is being used? Well, this is being used in massive amounts. Part of the reason people keep asking me to talk is because everybody is using this. This is, you're not alone if you're here thinking about it or wondering about it. We know, and I got to put these glasses on. Normally when I'm talking, I'm looking up at a big screen, but now I'm looking at my little laptop here. We know that if you look at all patients with GI issues, that over 50% are using some form of complementary alternative medicine. This has been looked at in inflammatory bowel disease. It's been looked at in chronic abdominal pain. It's been looked at in celiac disease. People are using this over and over and over again. And most people use it because they feel that it helps. And in the US population, the amount spent on supplements and herbs is tremendous. Over $40 billion in the last, well, it's not, I don't know about this here current year, but last year, over $40 billion was spent on herbs and supplements alone in the United States. That tells you how much people are spending to use for complementary alternative therapies, particularly related to the herbs and the supplements. This is very, very patient driven. This was not being driven by physicians. Physicians, for the most part, we wanted to stick our head in the sand. We said, listen, I just want to, ignore this. I haven't really studied this. I don't really know how to answer patients' questions. But the patients basically came out and said, hey, it's too bad. We're using it. It's helping us. We feel better when we use these therapies. And this is the first thing in all of my years in medicine that has really been patient driven. Patients have come out in the late 90s and said, listen, we're going to start doing things to help heal us. And I actually sort of laugh because a lot of physicians are using it, but don't actually talk about it. So I look at my colleagues and they say, well, I don't believe this stuff works. And I say, okay, well, what do you do? And what is your day like? Well, I go to yoga and I take some fish oil and I do vitamin D and I eat a plant-based diet and, I do some gentle meditation. And I always look at them and I say, well, why do you do it? You just said there's no data and it doesn't work. And they all look at me and go, oh, wait, that's true. Why do I do it then if I'm saying it doesn't work? The reality to it is that we are starting to see more people going in that direction. And we as a medical community have to be less judgmental of this. We have to be willing to accept it, willing to talk to patients, even if we don't have answers. And I think that it's really, really important. Multiple studies have looked at the amount of stuff that's being done. There was a Manitoba study that showed up to 74% at any one point were using some form of CAM. Dr. Kemper out at Ohio State showed 84% were using it. This was predominantly a pediatric population. About 50% a study out of the Deaconess. So the reality is that you're looking at over half. In most situations, half or more of the patients are using some form of complementary alternative medicine. Again, it's a fairly broad structure in terms of what you could call for complementary alternative medicine, but it's clearly being used by a lot of people. So people who are looking for this are not alone. And it's forcing us as physicians to be more sort of aware and looking at it and researching it more. So of all the things we talk about when we talk about integrative care is a multi-level approach. And number one is the most important thing. We can talk about treating acute illness, decreasing flares, long-term things, lowering the meds and what have you. But if we can do one thing, if I can get one thing to change in medicine, is to change from a disease to a wellness model. Because the bottom line is all patients, until it's time for them to pass on, All patients have more wellness than they do disease. When you wake up in the morning, does your eyes see? Do your ears hear? Does your heart beat? Do your lungs breathe? Does your GI tract process your food? Your kidneys make some pee? Do your muscles hold you up? And does your mind think? If you do, by definition, you have more wellness than you have disease. Even if something's missing out of that group, you still have more wellness than you do disease. And yet when we walk into the doctor's office, what do the doctors, myself and the rest of us, say? Well, tell me about your stooling patterns. Tell me about your belly pain. Tell me about whether you're taking your medicines. How's your compliance? We miss everything about what the patient is. And if we improve wellness, by definition, we decrease disease. And that's hard for the medical profession in general because we focus on disease and we focus on medicines to fight disease rather than to improve wellness. So this is my one statement that I say, and I've been saying this for the last 15 years, all patients have more wellness than disease. And it's really, really, really important for people to recognize that. And I always say, you know, my son, when years ago at Christmas time, he says, "You get what you get, right, Dad?" And I said, "Yes," because he didn't get what he wanted. And but I always say, we all get something. We all get something. It doesn't matter what we get. It could be diabetes, CF, it could be hypertension, it could be inflammatory bowel disease. It's not what we get, it's what we choose to do with it. When I got my arthritis, I did not look at this as a positive thing. I was miserable for 3 months. I could barely move. And I'm like, man, this is awful. But in the end, it changed everything I did. It changed my whole approach to the world. It changed how I deliver medical care. My patients now look at me and say, "Matt, when I do both kidney stuff and non-kidney stuff, obviously." And my kidney patients always look at me and say, "Matt, you don't talk about my kidneys." And I say, "Your kidneys are the easiest part. The hard part is how do you become the person you're supposed to be in this world?" And that's the critical nature of integrative care. We have to deal with acute illness. If you're having diarrhea, what can we do to slow that down? If you're having joint pain, what can we do to help with the joint pain? If you're trying to decrease flares, how do you keep the flares from coming back? How do you lower the side effects of steroids or Remicade, or decrease your cancer risks or the liver toxicity from 6-MP? What are things that we can do from an integrative approach? That's the other part of it. But more important than anything else is everyone has more wellness than disease, and that has to be said to the medical community over and over and over again. And patients should feel like they're being treated that way. So when we talk about the treatments, let's get into this a little bit right now. First of all, the IBD treatments, it's somewhat of an interesting dilemma, and that's from a nutritional standpoint, IBD is an inflammatory disease. I mean, obviously, it says it right in the name. And we know that certain types of foods that we eat have a tendency towards increasing inflammation. And this has been looked at through Mediterranean diets, through Okinawan diets, and different things that, and different dietary approaches that they've looked at sociologically. And last time I was given this talk, the person in front of me got up and gave a whole talk on individual diets, everything from gluten-free, dairy-free, to ketogenic, to vegan, to specific carbohydrate diet, and showed the pros and cons to each of them. And it was interesting because in the end, none of the diets seemed like they were particularly great or any different. And I got up to talk and I said, I really don't know what to eat. Okay, based on all this, I'm not sure what to eat. But it's actually fairly simple. And I say this to my patients and the kids that I see and the adults I see in the office all the time. Well, what do you think you should eat? What do you think was put on this planet to heal you? If you come downstairs for breakfast and there's a bowl of fruit and a Boston cream donut, and I always use Boston cream donuts because I love them, okay, and I say, which of these would you eat to heal you? Well, they always say the fruit. We intuitively have an understanding of what we should be eating. And yes, with inflammatory bowel disease, there are things that are here that that you just can't eat. You know, people can't eat popcorn or corn or some of the higher fiber things is harder for their gut, particularly in the middle of a flare. But the reality is when the universe or God put a chicken on the ground and said, eat the chicken, they didn't think it was going to look like a McNugget, okay? And so if we eat food as it was intended to be eaten, it makes a lot of sense in terms of decreasing inflammation. And if you look at the diets that do this, and in particular I use what's known as the anti-inflammatory diet, those are based on 3 essential principles. One, high in polyphenols, beta carotenes, phytonutrients, all the plant-based foods that you can tolerate. If there's things you can't tolerate, I get it. But if you can, whatever you can tolerate from a plant-based nature is important. Second is to lower the glycemic index. The glycemic index and the shift in starches seems to be a huge problem with this. It seems to increase inflammation, it impacts weight gain, and actually may play a role in some of our emotional states too. So I think it's really important to look at high levels of phytonutrients, lower the glycemic load, and lastly, bring in as many good fats as we can. Olive oil, for example, is a beautiful anti-inflammatory fat. When you look at the Mediterranean diet line, olive oil, basically they slurp the stuff up. I'm not telling people they should slurp up olive oil, but having said that, incorporating good fats and getting rid of some of the other fats that may be pro-inflammatory out of the diet are very important. There are times where people want and try going into an elimination diet. Elimination diets can be helpful if you are really sensitive to certain things. So if someone is not succeeding with the standard traditional anti-inflammatory diet, then we take a step back and say, well, should we try eliminating things and see whether or not it improves your symptoms, whatever those symptoms may be. But ultimately, we have to be somewhat intuitive with this. We have to say, well, what do we really think we should be eating? You know, we can't miss that part of what we're doing in terms of our dietary intake. So high as much as we can in the phytonutrients, low in the glycemic load, and if possible, get the good fats in as much as we possibly can. We can talk more about the dietary approaches in questions and answers if people want, but don't let yourself get too complicated. It really is one of those things that the more complicated we make it, the worse it seems to be. You know, Occam's razor, the simplest solution is typically the correct one. And I think that's really true for food. We understand that, you know, eating, you know, high processed foods is not good for us. Our body doesn't understand that. What can we do to change that? And even in some cases, decreasing flares with elemental diets have been used. And so we know that it makes a difference. We just have to be willing to sort of bring that into our lives. Even, and I always say, there is a healing component to Boston cream donuts, okay? Sometimes you just need one, all right? And so every food has a healing nature. If you went back before we even really looked at food in our health in a Western scientific way, one of the things we learned early on was calories saved lives. So just being able to eat calories sometimes is really important. So before we go, you know, demonizing foods, I like to think of them more with a healing intent. And if you have a child, for example, who is having a hard time getting in the good foods, you say to them, well, do you think food is important in your health? Just ask them. They go, of course it is. And then you say, well, what would you eat if you're trying to be healthier? Well, I'd eat more fruits and vegetables and, you know, better sorts of meat products and what have you. Okay, great. So every time they eat, I say, start your food with the most healing food in front of you. You can eat whatever you want, but always start with the healing food. And universally, you start seeing people taking better control in the long journey and not just over the short term. So when it comes to integrative care, first, what do I do when it comes to supplements and herbs and mind-body therapies? And second, what do I get asked? And I mentioned that a little bit earlier. I always get asked about supplements. Supplements are probably the biggest thing. And there's certain ones that I put high on the list. And again, the question is not whether the data is definitive. The question to me is whether the data shows a preponderance of the evidence to be moving in a specific direction. And this is one of the things that in medicine we have to be more aware of. A lot of times you hear about evidence-based medicine, and the fact is for every trial that I do one thing, there's another trial that tells me I shouldn't, regardless of whether I'm using medications or surgeries or whatever. We tend to change our minds about every 5 years. The reality is that I'm looking at what is the preponderance of the evidence, what is pointing me in a direction that makes sense and seems, based on all the information, that it would be helpful for the patients. And so the first thing I look at is omega-3 fats. Omega-3 fats are potent anti-inflammatory oils. They used to be much higher in our dietary intake. They've become less as the years have gone on. We're eating a lot more fish. We're eating a lot more nuts like walnuts and what have you. And as time has gone on, the relative amount of omega-3 fats has gone down in our diet. And it's true just because of the way our food is processed. They inhibit cyclooxygenase and they are anti-inflammatory. And I always sort of call them like nature's Motrin in terms of how they work in the body. It's been looked at in numerous inflammatory conditions, and there has been some early data that showed that a certain percentage of patients with inflammatory bowel disease have a relatively omega-3 deficiency. So I put that pretty high on my list. Interestingly, it may also, if you look at eating plant-based diets, but also looking at fish intake and omega-3 intake, you may also be talking about decreasing long-term cancer risks. Again, it's not completely definitive, but one of the most important things is it pointing you in the direction that this may be helpful? For a number of the reviews that were done initially showed that fish oil tended to decrease flares, tended to be better for people in general with inflammatory bowel disease. And then the last review didn't necessarily show that. So again, is it clear and definitive? No. But is the preponderance of the evidence pointing me in a certain direction? Yes, I think it does. I usually start with a couple of grams a day. And one of the big things you want to do is try and avoid the burpiness from the omega-3 fats. If some people are really sensitive to this, you can freeze the capsules. That's one of the things we like to do. I always tell people to take it with food because it's another thing that decreases the burpiness. And there are enteric-coated capsules that keep the burpiness from being as bad. One of the things that in the early studies with the omega-3 fats, it seemed, and inflammatory bowel disease, it seemed that the enteric-coated capsules were better. So I tend to lean in that direction for patients with IBD as far as using the omega-3s. All right, so this just again goes through what I was already talking about, saying that the early studies showed some benefit, and more recently it's a little harder to know. One of the interesting things that I found was in familial adenomatous polyposis, which is an inflammatory polyps within the colon. By taking omega-3 fats, they actually showed up to a 30% decrease in polyp size and number compared to controls. And what's also important with that is that it is that the control group actually had an increase in size. So this is probably even a greater effect than what was even estimated by the study. The reason I bring this up is patients with familial adenomatous polyposis have a very high rate of cancer. And if you can decrease those risks, you're trying to look at decreasing risk across the board of GI cancers. So I really like the concept of using this as an anti-inflammatory for the gut. Again, this mentions here about the use of the enteric-coated capsules and how it seemed, at least early on, it seemed to be better than the other than the non-enteric-coated capsules. Other supplements that are commonly used for this, glutamine. Glutamine is been used in chemotherapy for a long time to help enterocyte repair. So when people go in and have cancer treatments, they get a lot of esophagitis and they get a lot of GI problems. And glutamine helps to repair the enterocytes. It works beautifully, at least in my experience and in some of the studies I've seen, in helping patients who have GI issues related to their chemotherapy. There are a couple small studies looking at it in patients who have inflammatory bowel disease. The hardest part to glutamine is it's safe, it's well tolerated, it has very little in the way of side effects. But it takes a lot. You're talking somewhere between 5 and 10 grams a day, which means you sort of have to get the powder. The capsules typically only come in about 500 milligrams, which means if you're going to take, 5 to 10 grams, you're taking a huge number of capsules. So the powder, you can put that into a warm drink and drink it down that way. So for someone who's coming out of a flare, dealing with the flare, is trying to sort of have enterocyte repair and just sort of help their gut heal a little bit more, they can take anywhere between 5 and 10 grams twice a day, put it in a nice little warm tea or coffee or whatever they like, drink it down, and help that to improve. Lecithin or phosphatidylcholine was studied a number of years ago. Again, this is been found to be low in the enterocytes in patients with inflammatory bowel disease. And in patients that were steroid resistant and refractory, they were actually given lecithin and showed a significant improvement, with 80% going into remission versus those who weren't given this. This, again, is another bit of a harder one because you have to sort of get it as a powder. But again, you can put it in a warm drink, and it tends to work nicely for patients who are having more refractory conditions. I love the use of vitamin D. Up here in New Hampshire, probably down where you guys are, it's not such as big of a deal, but up here in New Hampshire, it's 100% vitamin D deficiency. We don't have anybody who has normal vitamin D levels. You know, we don't get enough sun, and in the winter months we can't process it at all. And it's really lower levels have been associated with inflammatory bowel disease. It seems to be quite safe, and depending on your region and what your levels are, a couple thousand units a day usually works really nicely. And the last review of all vitamin Ds look like you could use any product, that they're all actually quite good. Probiotics have been used for a long time, and one of the big things with inflammatory bowel disease is this concept of this dysbiosis. There's something wrong in the gut with the bacteria that are there. And more work has been looking at the bacterial flora and its immune modulation and the effect on the body and inflammation. There has been this suspicion that there's this disruption that's going on that may trigger or be part of what triggers the inflammatory bowel disease. They got excellent side effect profiles. And the primary one, again, I don't have any links to any of these companies. The primary one that's been studied has been VSL3, which is a very, very high dose probiotic. And it's been used particularly in ulcerative colitis to try and turn it around and stop the inflammation. There's really two approaches. Sorry, I'm going to go back here. There's really two approaches that I use for probiotics. One is, am I trying to get you into a remission? So if somebody really has a flare and we're trying to get somebody into remission, what do I do to try and get that to happen? And those are high dose probiotics that we use with multiple strains, using tens or hundreds of billions of colony forming units to get it to work. The second is, what would I use to sort of promote gut health? So if we look at the general population and what seems to be healthy and happening, what's the word I'm looking for? Healthy and promote just overall good health, gut health. Then we look at a smaller dose, and then we're looking at probably somewhere between 5 and 20 billion colony forming units. Those are the things that have been used, for example, in chronic abdominal pain. Those are the things that have been used for more of the kids who are dealing with other GI issues or adult dealing with other GI issues. So if I have somebody come in and they have inflammatory bowel disease, maybe they've been on courses of antibiotics, they might have had other things that are ongoing, we use that dose. If we have somebody with an active inflammatory response that we're trying to squelch it, we tend to use the higher doses. One of the things about the botanicals is that there's a million of them, okay? And the gut is one of the most sensitive organs to use botanicals with. Dr. Lodog, who is a magnificent physician and ran the program for us in terms of running our botanicals out at Arizona, said one of her favorite organs to treat with botanicals is the gut. And there's a huge amount out there, and it really becomes actually very confusing for patients. What do I take? Do I take what works for my stomach versus my large intestine versus my small intestine? And as you can see from the list here, and these are not listed in a specific order because I'm going to get into more of them here in just a minute, but there's aloe, which has been commonly used by inflammatory bowel disease patients. Very often they say it just soothes and makes them feel better and tends to work better in the upper tract versus the lower tract. Ashwagandha, which is an adaptogen and an anxiolytic, which tends to help people who are feeling tired and fatigued. Boswellia, also known as Indian frankincense, and I love that name because it makes me feel like I'm a magi of some sort. It's a potent leukotriene inhibitor and has been used for asthma and arthritis along with IBD. Chamomile is an anxiolytic and a gut soother. Licorice from the standpoint of its healing aspects in the upper GI tract, but also in patients who are on steroids because it potentiates steroids, the natural steroid effect, and sometimes we use it to help wean the steroids back by using licorice at the same time. We have to be a little bit careful with that because it can cause high blood pressure, but there are forms that don't cause high blood pressure that can work very nicely for esophagitis and gastritis. Marshmallow, again, I wish it was real just marshmallows. I tell everybody, you know, go make s'mores or something like that, but marshmallow, similar to licorice in many ways. I don't actually use much of it, but it is one of the things you read quite a bit. Meadowsweet, which is another anti-inflammatory, used commonly more with inflammatory bowel disease and patients who are dealing with arthritis. Oregano and oregano oil is one that, if we're looking as an antimicrobial, so people coming in who are having recurrent infections, that's one that's commonly used to help decrease some of the infections. Slippery elm bark, this is one that I'm sort of torn about. Slippery elm is a beautiful mucilage which helps tremendously for the upper tract. So if somebody has an oral lesion, if they have a esophagitis, if they have a gastritis, it doesn't seem to have the same effect because the mucilage, which is basically like it's like sticks to the lining and helps it to heal, doesn't seem to go as far down into the colon or into the distal GI tract. And yet a lot of the products out there will say, oh, we put slippery elm bark in for a patient who has ulcerative colitis, and it's not really clear that that's actually helpful. Could be helpful if you have esophagitis, gastritis, duodenitis, but not necessarily clear if you're looking at the distal tract. Turmeric, that's the one we're going to talk quite a bit about here. I love turmeric. I think it's going to be one that everybody should be on. I think the data is just, it's just waiting to come out on terms of its effect in the human populations for IBD, and we're going to talk about that one in just a little bit. Wild yam is known as colic root. It's an antispasmodic. Quite honestly, I don't use very much of it, but it actually sounds pretty cool. The list is very long, very long. It can go on and on and on, but there are certain ones that I recommend a lot, and one is turmeric. Turmeric, there's multiple studies. This is an older report on how many studies are going on through the NIH looking at turmeric as an anti-inflammatory. It's a common spice. It's been used for over 1,000 years. There's the polyphenolic curcuminoids, or the curcumin, which is actually the active ingredient. In India, and also now more here in the Western world, it's used commonly for arthritis and asthma. My Indian colleagues who say if you have GI problems, you make a soup with just the turmeric. If you have arthritis or lung issues, you make the soup with the turmeric, and then you throw in milk and pepper because it increases the absorption so that it affects the other organs. I love the use of turmeric. I also particularly like it because not only do I think it helps with the GI tract, but I also think that you can use it for other pains and aches that people have. So people having the chronic back pain, the joint pain that commonly goes along with inflammatory bowel disease, turmeric can be really, really helpful. As I said, it has anti-inflammatory process. It actually was decreased polyps significantly in patients who had familial adenomatous polyposis. I mean, striking decreases in their polyps, at least in one study. If you take it without fat, you don't get much absorption. So if you don't have black pepper or fat, the turmeric stays in the gut and works there. On the other hand, if you take it with fat or black pepper, you can actually get a capsule that has what's called bioperine or black pepper in it. And that actually not only works in the gut, but it can also increase the absorption. Turmeric doesn't get absorbed very well. So more and more of my patients use it both for not only the GI tract, but also for the other aspects that go on, the other inflammatory issues that they're dealing with, excuse me. You need quite a bit of it. You can't just, a lot of people say, well, I cook with it and what have you. I like that. I really like the fact when people put turmeric in. I make a point now of putting turmeric in almost everything that I cook. Well, I shouldn't say that, but a lot of the soups and things that I make. But you do need at least a few grams a day. And so therefore, typically you need to get a capsule, which are usually between 500 and 1,000 milligrams per capsule. All right, let's see, did I not? It didn't go forward. Uh-oh. You there, Alicia? I seem to be stuck.
Yeah, I am here. Just a second. Let me pull up your slides. Would you stop sharing and I'll start sharing mine?
It just worked.
Oh, excellent.
Yeah, it worked. Sorry. Okay. Everybody still there? You didn't all run away? The second one I talked about before is Boswellia. Boswellia, again, Indian frankincense, leukotriene inhibitor. It comes from a tree in India. It's a gum resin that you get from there. Actually, at one point when I was up in Maine, I couldn't get Boswellia because so many patients were reading about it with asthma that they were all going out and buying it up. There are mixed clinical trials. Some say that it's helpful. Some say that it doesn't with inflammatory bowel disease. With turmeric, there's a number of animal studies looking at animal-induced ulcerative colitis, looking at long-term, looking at Crohn's disease. There is a number of studies that have shown significant decrease in inflammation with turmeric, and I think that the human studies are going to be even more positive as we move forward. We can't, again, we're looking at preponderance of the evidence. With Boswellia, again, mixed clinical trials, seems to be quite well tolerated, and again, when I have a patient who has both IBD and asthma, I like using it. I think it's one that works quite well for them. This is the one, wormwood or artemisia, that I really wish we could get more studies on. Back about 10 years ago, 8 to 10 years ago, there were 2 studies that were done looking at artemisia. Artemisia or wormwood has been used overseas forever for inflammatory conditions. It's been used for malaria. It's been used quite a bit, and the initial studies were actually quite striking. They had small populations, but patients with Crohn's disease who were randomized to placebo-controlled groups, and 90% of the patients who received artemisia had improved and were tapered on their steroids. Again, this was back in 2007, where steroids were being used quite a bit, with 65% going into complete remission, and none of them with placebo. This is quite striking to me at the response that they had. And when they looked at patients in 2010 who took it, their Crohn's disease activity index, was significantly better as compared to controls. I keep looking in the literature, seeing if anybody's going to do any more with wormwood. This is one that I like using. It does have a little bit more, when I've used it, there seems to be a little bit more reaction to this. So I've had people feel a little bit more the side effects profile, I'm not sure it's quite as good as maybe like the turmeric or the Boswellia. But having said that, I think on the horizon we might see this pop up as a good treatment for IBD. What I'm commonly asked about with this is aloe. I mean, aloe comes up every time. Every time I give a talk on this, people talk about aloe. There's very little in terms of data that shows aloe is actually helpful. Having said that, across the board, people say to me, I love aloe. It seems to make me feel better. My gut feels better. And there is at least a small trial in ulcerative colitis that showed that it may improve inflammation in the gut as compared to placebo. The big thing with aloe, and the reason I bring it up, is because aloe, for the most part, is quite safe. It tends to be very well tolerated. But the downside to aloe is that if you get a product that has aloin in it, aloe, you want the fillet, the inner part of the plant, the gel is what we're really looking at. And that's what you want to get as your for what you're drinking. So if you're getting something, you want to get something that has the fillet in it. The rubbery outside latexy component has a lot of aloin, and aloin at higher doses causes a lot of diarrhea. As a matter of fact, aloe used to be used for constipation a lot because the aloin that was in it actually caused diarrhea. Well, if you got inflammatory bowel disease, last thing you want to do is get diarrhea. So the big thing I tell people with aloe is it seems to be quite safe. It seems to be quite well tolerated. Just make sure you get a product that says it's aloin free or 99% aloin free, so that you know you're getting a product that isn't likely to cause diarrhea. The other therapy that comes up a lot in discussion is helminths. These are worms, and I know it sounds gross, but a lot of interest came up with using either hookworms or whipworms to try and decrease IBD flares. The hypothesis behind this was the belief that people in cultures that have more parasites, particularly worms, have lower rates of certain immune-mediated conditions, and inflammatory bowel disease being one of them. Whether that's real or not is not 100% clear, but that was the hypothesis behind it. And they use both trichuris, which is a whipworm, and Necator, which is a hookworm, and you eat the little eggs, and then you see whether or not your disease goes into remission. there's been the preliminary stuff on this was sort of interesting enough that a lot of people were contacting me saying, how do I get into a study to look at this? Well, it turns out that the bigger studies just didn't show that it panned out. When the people started looking at this on a larger scale, that the worms and the Hellman therapy doesn't seem to be particularly effective. Now, I say that with the concept that, if you are one of the people that it helps, even if you're not in the high percentage, you're one of the 30% or whatever that it seems to be helpful for, then you want it. On the other hand, if you're trying to evaluate what you're going to do, I sort of put this lower on my list right now. I get asked about cannabinoids in cannabis all the time. This is probably one of the hotter and yet somewhat more controversial topics out there. Some of it depends on which state you're in, whether it's legalized from a medical standpoint, whether it's legalized from just a recreational standpoint. Up here in Maine, New Hampshire, and Massachusetts, they've legalized it from the standpoint of being able to use it with doctor's notes and what have you, and it's been somewhat controversial in terms of how people feel about it. The American Academy of Pediatrics has not taken a really positive stand on this. If you read most of the stuff they talk about, it's not been a great, they haven't really been out there as far as cannabis in general for the pediatric population. I've always argued that, yeah, maybe, there is some downside to it. On the other hand, I don't think it's a whole lot more detrimental than a lot of the medications that we're using, and some of the medications that we're using that maybe not be even that helpful. The pediatric versus adult is a hard one because there is still some concepts that as the pediatric brain is developing, we may not want to be exposing it to cannabis. And the THC versus the CBD is the other big topic. People who do a lot of medical cannabis talk about the fact that you need both. They like the THC and the CBD, the THC being the one that causes the more sort of high, if you will. The CBD doesn't have that effect on the body, and it actually works from a different mechanism. What I didn't know when I first started looking into this was that the body has extensive cannabis receptors, which is sort of funny. All throughout our body, we have these cannabis CB1 and CB2, and they're loaded throughout the body, including through the GI tract. And the body actually makes what are known as endocannabinoids, which again, I didn't realize. I knew that we make endorphins, like a natural morphine, but I did not realize that we made endocannabinoids. And the body sort of develops these and makes these over time and reacts and makes different levels of them based on what's going on in our life. The endocannabinoid system has been shown to impact inflammation in the gut. So they have shown that there is some kind of interaction that goes on between inflammation in the GI tract and what the exact mechanism is not 100% clear, and what happens through these endocannabinoid receptors. Historically, this was used predominantly to treat inflammation and pain. So the idea was if we use cannabis, we can treat pain, and we might be able to change the inflammation in the gut. The two components are the THC and the CBD, as we talked about. The first has the more psychotropic effects. But interestingly, the CBD component doesn't really do any of that. What it probably does is actually inhibits the breakdown of the THC and potentiates the THC effect. Well, if there's no THC there, what it probably does is potentiate your body's own endocannabinoids. So what happens is you make more, your body doesn't break them down as much, and you get a better overall effect with this. It's interesting because studies have shown that about half the patients who have inflammatory bowel disease are self-medicating with cannabis. At one of the conferences, I said, okay, everybody raise your hand who's doing it. I was kidding. I didn't really want them to raise their hand. But it's a very commonly used therapy that's out there. And some small studies showed that there was symptomatic improvement, meaning that they felt better. Having said that, they didn't have enough power to show statistical significance significance. And as this has been looked at, it doesn't seem to change the outcome of the disease. There was actually one study that said that there may be some problems with certain numbers of patients needing more surgeries who are on cannabinoids or on cannabis. Again, very small studies, and it's really not that clear. But there doesn't seem to be any clear studies that shows that it helps with inflammatory bowel disease. There is concern whether it may change gut permeability, whether there may be gray matter changes in the brain in pediatrics, and this whole concept of lack of motivation. This is another study that just came out showing that patients who were using this consistently in pediatrics had lack of motivation as they were getting older. Having said all of that, if you're dealing with, if you look at what CBD oil, for example, has been used predominantly for, and again, the CBD oil or the hemp oil doesn't have the THC component in it. It's been used for anxiety, pain, and seizures. And the information on that is getting a little bit stronger. So if you have somebody who is dealing with significant anxiety, you might not be treating your Crohn's, you might not be treating your colitis, but if you're having trouble with sleep or anxiety, or you've had some pain that you're trying to deal with, then CBD may be helpful for you in that case without the effect of the THC. We don't really have all the information. I think as this keeps expanding and growing, we will be able to tell people more. My colleagues in the pediatric GI world say, well, there's no data that shows that this is helpful. And I don't disagree with them. It doesn't show that it's helpful for Crohn's or colitis. Having said that, we're not talking about just that. We're talking about how someone is as a person. If that person is having problems and having anxiety or having pain, could it potentially be helpful for them? And I think that's where this really comes into play. The doses on the CBD oil are a little hard to know. You see doses from anywhere from 2.5 to 20 milligrams for treating pain and anxiety, but you see doses in the hundreds to thousands of milligrams to treating seizure disorders. So most of the time, the recommendations are, if you're going to use like a CBD oil, to start low and work your way out. Again, there's no, and I know this is a state-to-state thing. Alicia and I were talking about this in Texas. It sounds like it's not even allowed. But when I have to bring it up because everybody asks about it. I don't think there's a patient that I've seen, whether it's related to IBD or anxiety or my ADD kids or my nephrology kids, who aren't asking about medical cannabis now. So stress reduction, and where are we at time-wise here, Alicia? I'm just taking a quick look. Oh gosh, we're coming to the end, aren't we? Okay. Yeah, you can tell me to shut up at any time, Alicia, okay? But stress reduction, this is critically important. One of the things I tell people all the time is we can't predict your disease. No matter what we tell people, no matter how much we say to them, this percentage has this happen and this percentage has that happen. We really can't predict anything in medicine that way. On the other hand, what we can predict with 100% certainty for every single patient who's diagnosed with a chronic disease is stress is going to play a role. 100% of the time. So we should be doing this right from the beginning, looking at breath work, meditation, prayer, whatever it is that you do to help with your treatment. There is not another health system out there, traditional Chinese medicine or anything, that doesn't do this. We have to be looking at this as part of what we do. We use mind-body techniques for pain management. We use self-hypnosis for the abdominal pain, as I mentioned earlier. It's wonderful for doing this. The interesting study in 2017 looked at gratitude in patients who had both arthritis and inflammatory bowel disease. And gratitude showed improvement in depression in these patients in 6 months. So people who were more grateful for what they had were less depressed 6 months out. The scary part to this, over 50% of the patients who were in the study had depression at 6 months out, which tells you the impact that this disease can have and that chronic disease in general has. As we talked about with whole systems, we love to use everything. I'm going to skip the homeopathy part and talk about, just say traditional Chinese medicine, acupuncture. There are needleless forms of acupuncture if kids are looking for those or somebody has a real needle fear. It's called Shonishin, and I love the use of acupuncture. The one caveat I tell people about going to traditional Chinese medicine doctors is that if they're using products that come from another country, they sometimes can have things in them that we don't want. So I'm not a big proponent for using herbs or supplements that are not being at least within the realm of what the FDA looks at from a clean practice. So finishing up, this is something that Lao Tzu said a long time ago, and I love this concept. It's about living a healthy lifestyle, and it talks about eating your food and walking and just doing things to be healthy as a healthy person. And today, where we're voting, it also says to choose your leaders for their kindness and their knowledge rather than their power and money, which I think we could all learn a little bit about. And lastly, this is my dog Omar. Omar is one of our pet therapy dogs. He comes in, and sometimes when life is really stressful, one of the best things is to be part of a team like the Crohn's and Colitis group, because together, and this is his friends Libby and Lola, we tend to be a little bit more calm and peaceful in the world. So that's it. Now, I know this is just the tip of the iceberg. Alicia, what do you want me to do now?
Well, let's try to take some questions. We are running a little bit long, but hopefully people will hang with us for a little bit here. So let's take some questions. I'm going to start out while people are going to putting questions in the question box. So everyone take a look to the right. There's a question box. You can type your questions in there. And we've got our first question. So somebody says they were having some problem with the audio. So we will be posting the video as soon as I can possibly figure out how to do that. So hopefully very soon. And then also we'll get a chance to post the slides along with that. So somebody's asking if you could share a little bit more information on the anti-inflammatory diet.
Yes, the anti-inflammatory diet. Again, I don't have any links to any companies or whatever or any disclosures. One of the best places to find out about the anti-inflammatory diet is go to drweil.com. Andrew Weil is the one who sort of was one of the founders of this concept, and it was looking specifically at what was done in cultures that had healthier lifestyles with less overall diseases, and it really is primarily based on the Mediterranean diet with some of the Okinawan diet sort of folded into it. And there's one, you can get handouts online on it. And the concept is really about eating foods that lower inflammation in the body. And if you look at the plants that are out there, leafy greens, anything that has lots of colors and what have you, are excellent for that. The other part to it is trying to lower the starch content, and you see that a lot. People are eating lots of breads, lots of noodles, things that naturally have a lot of flour-based, which raises the blood sugar very quickly and stimulates the inflammatory process. And again, the good fats. So if you want to get specifics into this, you can go to one of those handouts, because he actually breaks it down and talks a little bit more specifically about it. I also have handouts, so Alicia, if you want anything, I'm happy to send it to you, and you can let people have it too.
Absolutely, and that's Dr. Weil, W-E-I-L, just as a note.
Yeah.
So we have, somebody was asking, are supplements effective for those of us with lower IBD issues that are confined closer to the rectum?
Yeah, great question. We get that quite a bit. People sitting down with sort of distal disease. Distal disease, I try and use more of the probiotics. I try and use more of the omega-3 fats, particularly the enteric-coated ones and the turmeric. Those are the primary ones that I look at more distally. These are things that still travel into the distal colon, or at least systemically lower the inflammatory process, because that's the other part to this, is you're not only trying to get it to that target area, but you're also trying to get it into the system to lower the inflammatory process. So yeah, I do like using those for distal disease.
Great. Somebody was asking if there's an alternative bread you can tell us about for those of us who crave bread, but it sounds like perhaps are not eating gluten or wheat.
Oh, I know. It's a killer, isn't it? Because, this is one of those things that you're trying to figure out what's the best thing to do. And probably the most important part of the bread is to have as much stuff in the bread as you can. That sounds like a weird way to phrase it. And I feel, again, there are people out there arguing about whether lectins play a role and all of that kind of thing. But the bread that is not as easily compressible has more of a hardness to it, with seeds and what have you. Those tend to have overall lower glycemic loads than the real fluffy sort of bread. The way we always say it is, if you can take the bread and sort of condense it down into a marble, like just squeeze it down into a little marble, like a piece of white bread, those probably have very high glycemic loads. They're very flour, or a lot of flour, a lot of air, a lot of starch. If you take it and you try and condense it down and it doesn't, then it's better for you. So things like pumpernickel bread, things of that nature that have a little bit more, have a lower overall glycemic load. I don't have a specific bread that I tell people to buy. I just try and lower the load a little bit more. And again, if you're dealing with gluten problems, looking for, just because you get something that's gluten-free does not mean it has a low glycemic index. The fact is that once you powderize the flour, it increases the glycemic load. So people come to me all the time and say, well, this doesn't have any wheat in it, so it's good for me. Well, it doesn't necessarily mean it's the case. You want to have something that has a lower glycemic load. And some of the online handouts actually tell you the kinds of breads to switch to lower the glycemic load, like pumpernickel bread or heavily seeded breads.
So Katie is suggesting everybody takes a look at sourdough bread, which is low glycemic as well. So thank you, Katie, for your recommendation.
Yes.
Somebody's asking, is there such a thing as taking too many different supplements?
Yeah, that's a great question. There can be. We can't assume the supplements by definition are safe. It's like, if you think something has a therapeutic intervention, then it also has to have a potential for causing a downside, for triggering some kind of downside. So, people will say to me, well, I think this really works well and it has no side effects. Well, you can't sort of have both. Every time you have a therapeutic intervention, whatever it is, there's a potential for some kind of downside. Some of the supplements will interact with your medication, so you have to be very careful of that. St. John's wort, for example, is one that has a lot of interaction with the cytochrome P450 system, which changes medication breakdown. So you have to be careful of some of those things. Sometimes you're just taking too much and it's just overwhelming, and people just feel like, man, this is way too much for me. So I'm always looking for targeting things that have data, that have information that helps with these, instead of just taking what everybody recommends. I always laugh. People don't listen to me, but they go to their hairdresser who says they should take this thing, and they come back with something that costs them $300 and it might have very little therapeutic value. One thing I will tell people when you're looking at supplements, be very careful about the term proprietary blend, okay? If the thing says proprietary blend and doesn't list the number of milligrams it has for each individual thing, then I would not recommend buying it, unless you have somebody who you really trust that's recommending it and knows what's actually in it. Because proprietary blend, let's say you get an anti-inflammatory gut proprietary blend of something, and it lists things like turmeric and boswellia and what have you, and it has a total of 400 milligrams. Well, by definition, it doesn't have enough of any of them to actually be effective. So you want to make sure that if you're getting it, you know exactly what's in it, and that you're not buying something that just has a list of things.
Good information and advice. I had a quick question that I jotted down. Anemia is a real problem in our population, and the tricky part about that is a lot of the foods that are recommended for people to eat when they are anemic are kind of tough for some of our folks to process. Those leafy greens and nuts and seeds, and
right.
So I'm curious if there's a way to supplement, or if there's some better foods you might recommend.
Yeah. So in terms of getting iron in, like that kind of thing.
Yes.
Yes. Yeah. Okay. First, one of the things you can do, and again, I don't have any data that shows this to be the case, but this is one of the things that's commonly recommended, is use cast iron pans. We've gotten away from using cast iron pans, and that's we see a lot of low ferritin levels in our population right now. Matter of fact, low ferritin levels have been associated with ADD, anxiety, sleep disturbances, and this has become almost, for lack of a better word, epidemic. And people always say, why? I still eat these foods. I eat meat. I might eat some of these other, leafy greens or what have you. And some of it is that it's just not in the food the way it was. And a lot of the leafy greens are a little bit easier to digest than some heavier fiber things. But try using cast iron pans. It's one of the things that we sort of underestimate how much iron we can actually get from the way we cook the food. The tendency now is to use sort of stick-free, the pans that don't have any way to stick to them. I don't even know what you call it, but try getting some cast iron pans and see if that will help a little bit.
Okay, great. So final question. We have one from Lori. She's asking if there's any specific recommendations that you have for people with J pouches.
Oh, good question. Well, the big thing with the J pouch is whether or not you're, all right, the problem with the J pouch is some people get a lot of inflammation in them, and they can be sort of irritating. So a lot of people are using probiotics in the J pouch, taking them orally for that. I think, other than that, I don't really look at things differently than I do the rest of the patients with IBD. I use the same things that I would normally use, the turmeric and the omega-3s and what have you. So it's a good question. I'm trying to think of what else I would do. It really comes down to what they're dealing with, if they're dealing with other symptoms with their J pouch.
Okay. And this is actually, I'm going to make this my final question. I apologize. I had somebody asking about if they were looking for an integrative medicine specialist, where would they look?
Oh, that is a really good question. There's a couple ways to go about finding, and it is hard because you really want a true integrative medicine specialist. You don't want to get someone who's just going to do alternative therapies for you. It's one of the biggest problems we have is people going out there and having not getting really good advice on terms of what to do. If you're looking for it, you can actually go to some of the centers will actually list their integrative medicine teams. So if you're in Houston and you look at the Houston area or Dallas or wherever you are, they will sometimes list their integrative medicine team that's there. What you're trying to find is what is their training in integrative care, and that's probably the thing that you're most looking for. Have they done any official training in integrative medicine? So very often people call themselves integrative docs and they might have done a 6-week course in something or whatever. If they've done one of the fellowships, particularly like the one done down at the University of Arizona, that means that they are a physician or a nurse practitioner or a PA that has actually gone through official training in terms of bringing in all of these things together. So really look at what their educational background is. There are ways, if you talk to your doc and just say, listen, I'm looking for an integrative practitioner, they can contact people like me or somebody in their area that might have gone through the training, and they can find local docs for you for that. We have one of our peds GI docs up where Mark Integli and I, we work together up in Maine, and now we're down here in New Hampshire, and he went through the training, so he's done it for his. There's not a lot of gastroenterologists that have gone through the training. There's a handful of pediatric gastroenterologists who've gone through the training. So big thing, look at your wherever you're getting your services. Look and see whether, if in their institution or their health system, whether they have an integrative program, and then look to see if they've done really official training in integrative care. Then if that's not working, talk to your GI doc, ask them if there's anybody that they recommend, and if they're not sure, they can always contact us or go through the Crohn's and colitis group. Like up here in New England, as Alicia knows, I work with a lot of the docs from Harvard and Tufts and Dartmouth and those places, and once they know your name, we help connect people to people.
In your case, once they knew your name, you became the expert in everything anything alternative medicine, complementary medicine. They say, ask Dr. Hand, he knows.
Yeah, so I know.
Yeah, well, that's a great thing, though. Thank you so much, Dr. Hand. This was super informative, and I know I really, really enjoyed the presentation and all the information. So thank you, everyone who attended tonight, and for hanging on for a few minutes longer. It was such great information, I didn't want it to end. So thank you again so much. I want to thank my sponsors one final time, AbbVie and Alpha Sigma and I forgot one, I apologize to University of Texas Medical Branch for your support as well. So thank you, everyone. I'll be posting a video of this online and sharing some resources with you as soon as possible. So take a look. Look on Facebook or via email and things to find out exactly where I post it. So thank you again so much, everyone. Have a very good night.
Thanks, Alicia. And if you need anything or any of the patients need something, let me know.
Great. Thank you so much.
Thank you.
Bye-bye.
Bye.